Good afternoon. It's my pleasure to introduce myself for those of you who may not know me. I'm Betsy Close. I'm the Medical Director of Primary Care for Erlanger Medical Group, and I'm also an Associate Professor in the Department of Family Medicine. What a year it has been. We have all been struggling and are sick of hearing about COVID, and there have been many changes all across healthcare, but certainly I can comment on the ones in primary care. One of the biggest things is the amount of information that we've had to digest. It has been said that in 1950, it took 50 years for medical knowledge to double, and then it was estimated in 2020 that medical knowledge would double in 73 days. On the time of COVID, it felt like 73 minutes. So certainly we have all had to navigate information overload, and hopefully you've survived that well. Another significant change is the push forward of telehealth as a useful tool to take care of our patients. 154% increase was seen in the first quarter between 2019 and 2020. The payment landscape was forced to shift, and I think these are lasting changes that are here to stay, which is good news for all of us to be able to take care of our patients the best of our ability wherever they may be. And for those of you who have doubts about people's ability to do telehealth, my oldest successful telehealth patient is 96 years old. So I believe everyone can do it with a little coaching. We also adapted to varying masking and testing guidelines, all the while helping our patients navigate fear and misinformation. This continues now with daily conversations about vaccines and addressing their concerns and hesitancies. The benefit of a strong longitudinal relationship with your patients cannot be underestimated when it comes to these kind of conversations, and certainly that's a strength of primary care. The gaps and shortcomings of equity of healthcare were also laid bare. The disparities are glaring, especially in the light of COVID, which disproportionately affected certain groups. And we can definitely say that hopefully this will be the catalyst for change to move forward with population health and value-based care, and hopefully will lead us down the path of providing high-quality, equitable, cost-effective health care for all patients. Now we're in the phase of dealing with the sequelae of the past 12 months. This includes mental health struggles, financial stresses, costly missed preventive care visits, both for patients and healthcare workers alike. We've all seen cancers that could have been diagnosed sooner, and we've seen the struggles of substance abuse as people have tried to cope with the stresses of the pandemic. I encourage all of you to utilize a resource that we have available in our community. The Hamilton County Medical Society has an initiative, LifeBridge, which provides counseling, mental health services for physicians at no cost. So certainly, please visit the website, lifebridgechattanooga.org, and if you see people struggling, make sure you reach out to them. And as if that was not enough, the cherry on top of the past year were the most significant evaluation and management code changes in over a decade. That was more than enough to digest in 1 year. So with all of these changes, I certainly hope that I will be able to help my primary care colleagues in partnership with our specialist colleagues successfully navigate the ever-shifting landscape of healthcare. And may the next year of change be a year of change for good. Thank you, and if you have any questions or concerns, feel free to email me at elizabeth.close@erlanger.org.